tonight what we're going to do is deal with a lot of different topics of how PBM can help. So if just glad you could join us, and we're going to be starting shortly. I did want to say that we are doing, as we usually do, we do a poll ballots go in for every time you watch the program to the end. And we are going to draw for April. We'll have that announced next week, Tuesday, as to who won for the month of April. So, and we've started a new month now. So glad everybody could be here. PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's the sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have two different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can. Okay, so first we'll start off, and what we're going to be discussing tonight is all the different applications of, we have a card for photobiomodulation, and there's a number of different types of indications that this can be used for, and I will be going through a list of those, and then I'm going to invite everyone to ask their questions. Partway through, we'll get into the question answers, so start thinking of questions as we go through this list. So one of the categories is preventing cancer therapy side effects. We're going to also offer a listing at the end. So everyone who wants to get a copy of this, we will be posting this on our website as well. But if you want to get an early copy of it, it has the indication, and then it has a number of different links that are attached to that. So you could download it and then click on it, and that will make life a lot simpler to find out about some of these things. So the first thing we're going to be discussing is preventing cancer side effects. We're working right now with a researcher in California for oral mucositis. Oral mucositis is when a person has chemotherapy treatment. The fast-growing cells inside their mouth breaks down, and what it does, it can be very nasty. It's like one ulcer on top of another inside the mouth, and it can get so bad that people can't even swallow because it goes all the way back down the throat. So people end up on a feeding tube. And what the research has shown is that PBM light being used, and it can be done with an oral probe, or it can be done with a light shining inside the mouth or through the cheek, but a person can actually prevent the side effects, these nasty side effects. So it promotes the healing inside the mouth. Very similar to if you had a canker sore inside on the wall of your cheek, you can heal that by using PBM. Now we do have the oral probe, which is right here, that one can use to treat inside the mouth. This just snaps into the device. But it allows for that light to be used for the treatment. So with oral mucositis, they've been able to show that in a number of studies that they can totally prevent this from happening, and the person then can actually finish their chemotherapy treatment where they may have to stop it because they can't eat anymore. They have to have a feeding tube and that. So very, very beneficial to use the PBM. Now we actually have a special device that we've created for this trial that'll take place in very shortly. It's everything had to be ready, and it is just one final some document that needs to be finished up on, and we will have a study on a whole floor using our device in a hospital that deals with cancer on 2 of the floors for the patients that have to be in the hospital the full duration during this cancer treatment. So one floor will be totally with light therapy, and the other floor will be just regular therapy to try and help the patients. So that will be coming up shortly, and when we do have results from that, I'll let you know. One of the oral mucositis areas is also called burning mouth syndrome, and it can be people can get different types of flavors, or even somebody could be using an aerosol can of, let's say, of something, and instead of it being just nice, pleasant smell, they may sense that it's like somebody just finished spraying Raid in their mouth. It's horrible, and our device has been able to help some people with the trial that we've been already begin working with on some difficult patients, has helped them in that situation. So there's also the inflammation on the back of the throat, and that's also been able to be helped with PBM. Another area is inflammatory conditions in the body, and that can be all different areas of the body, and I'll just give you a few of these. Achilles tendonitis is an area that, again, of inflammatory condition. Allergic rhinitis, hay fever can be helpful. Arthritis, and we have had quite a number of people that have been able to use our light for arthritis and have seen a significant reduction in swelling. So they maybe can't use their hands, they can't bend their hands or in other parts of the body, and very well without a lot of pain. And they can actually do it without taking drugs. So that's something that's very beneficial long term. And again, we'll be posting all of this information, and also in the chat, you can click on any of the links there or copy them, or as well as I mentioned at the end of the program. Asthma is another condition. I've actually seen somebody with asthma that they used the light, the mini canopy on their lungs, and they were able to see that the whole day they didn't need the puffer. Another person with ARDS found that normally if they would do anything to exert themselves, if they tried to do a quick sprint, they'd have a difficult time being able to breathe, like having to stop and just wheeze. Well, one of the individuals, she had done the treatment that day, and she was running out of time to go to Home Depot, and she parked her car and quickly, without thinking, ran to the door to get in yet before they closed, and she stopped and she realized that she was gasping for air, that she was much better, and the only thing she could attribute it to was the fact that used the light on her lungs. Now in my case, when I had COVID, I had double lung pneumonia. My blood oxygen was measured at 80%, and I started using the light right away on my lungs every day, 3 times a day, for about 20 minutes front and 20 minutes on the back. And in 2.5 weeks, I started coughing real bad, and I thought I actually was getting worse. But as it turned out, I went to the hospital. They did another set of x-rays and another panel for my blood and everything. And they said my lungs were significantly improved from the last set of x-rays. And they were quite surprised that in 2.5 weeks, I had seen such a recovery from my lungs. And every time I did the light therapy, my lungs, my blood oxygen would go up 1 to 2% and then fall after a little bit back down. But over the 2.5 weeks, I started getting up into the lower 90s, and you could see from that side that I was improving. So another area is another type of, they figure it's inflammation, is Bell's palsy. Can be inflammation or actually a damage to the facial nerve. And there's been people I have not seen directly, but I've talked to a doctor who treated one of her patients, and Bell's palsy with the whole face kind of pulled down, the nerves like not working properly. And one treatment, the doctor expected that this person would need to keep coming back, like for many treatments. And as a matter of fact, for this one individual, the one treatment the next day, they were able to have normal function. So whatever it is, however the PBM was able to help that healing or reduce the inflammation in the area that was causing that issue,
it actually was just one treatment. I'm not suggesting that these treatments that we're talking about here are all things that, one treatment's going to do. This is something that you may have to treat sometimes for weeks or months. I know when it comes to arthritis, one woman a senior had arthritis bad in both knees. They were talking about replacing both knees for her, and she couldn't get out of a chair. She was walking with a walker, and she diligently treated herself for 6 months. And 6 months later, she did not need a walker. She didn't even require a cane, but it was able to walk around without pain and be able to get in and out of a chair without help. So that's pretty significant, but it took 6 months to accomplish that. There's obvious different types of dermatological problems: dermatitis, eczema, and is something that we've been able to see. Psoriasis, where the skin surface has been able to improve because of using the light, PBM. And again, I'm pointing out things that are on the research page. You can search it, or you can find the stuff that we have in our links. Frozen shoulder is another thing, and I can tell you that I still have a little bit left, but earlier in the week I couldn't move my arm, so I couldn't lift it off my side of my body, and I kept treating on that area, and every day with it was able to do the treatment, and within a few days now I've been able to see I'm able to lift my hand up and put it back, and I couldn't even turn on the turn signals, couldn't even reach open the door. So it can help in the acute phase of these kinds of things. Tennis elbow, something that we've been able to see as well. One individual was quite the surprise, and I think that, I don't know, they'll have to find, eventually they'll probably figure it out, but like the nerve bundle, you have nerves going beside each other, and I'm wondering if it's almost like some kind of adhesion, or it's almost like having a splinter in your fingertip, and you can't use your finger as long as that little tiny splinter is there. And light has that ability to just dissolve whatever that is. Now, I'm not sure with the sliver, but in this case, this individual is limping for 19 years because of the problem of in the foot, and it was somewhere in the ankle area that he had quite a bit of pain when he'd move as he would try and walk, and he did one light treatment and it was gone, and he didn't require a follow-up treatment. There's another woman that I have a light chair. She had something going on with, I'm not sure if it's the fascia or through the nerves, but she, for 8 years, had severe pain in her back, so that she couldn't sit. She could stand up, she could lay down, but she couldn't sit. If she tried to sit, the pain level was excessive. And she sat in my light chair, and she did the light on the lower area of the back. And one treatment, 20 minutes later, she was crying, and I thought something went wrong, and it wasn't. She ended up sitting down on the floor, sitting on the chair, sitting on the couch, getting up, sitting down again. She says it's gone, and she was still crying, and tears of joy. And then she went home to her husband, and I guess I called her 3 days later and ended up talking to her husband. And at first he said, as soon as his wife came home crying, he wasn't too happy with me, but then he realized that she wasn't, again, it was tears of joy that the pain was gone. And that was the one and only treatment she needed. It didn't come back again, which is pretty amazing. Again, I'm not saying that that's normal. It just happens sometimes. It's really neat when it happens. We've had sciatic hip pain that's been helped. So, so there's mentioned some of there's general pain information there. There's low back pain, how it can help with low back. And I know I mentioned this before on the webinars, but I've had it where I had serious, right in the very beginning, I had injured my back some 20 years earlier. I fell from a ladder, a second floor height, onto concrete. I didn't break anything, thankfully, but every year, 2 years, I'd be in so much, I'd get a muscle spasm and have so much back pain. And it was about 15 years ago, 16 years ago, I guess now, that I had met up with the one doctor for my wife, and we developed a special, very, very powerful light for cancer, for a cancer treatment. We've got patents for it, and that we're still waiting for some acceptance. We can't use it in North America, but anyways, what happened from that is, if you'd have told me that you could shine light on your back and it's going to get rid of the pain, or shine it on your shoulder or elbow, you know, that's going to get rid of the pain, I would thought you were nuts. But for my own situation, I thought I happened to had needed to do some tweaking on the high power light that we developed for the cancer. And I thought I would put, at this one point in time, it was very early on when I had developed this high power light, and I thought, well, I'm in so much pain. I put it in the back of my chair, and I sat down, and I could barely sit down because of the pain. And about 20 minutes later, the pain, I couldn't believe it. Like if I'd rated it on a scale of 10, I had like an 8. It was just screaming at me, the pain, continuously while I was trying to work. And after the 20-minute session, it was like way down to like a 3. It was still there, but it had made such a change. And that's why I developed all the lights that starting back now 15 years ago, with the light chair, which is something that I don't sell anymore. There's also another company, one of the companies I started, called Genesis Health Light. It has a high power halogen light inside of it, and it has special filtering. And we help so many people with this device. And it's just only recently have we developed the Palm devices, and these devices are the same type, well, same or even more powerful than my earlier version there, but using LED technology. So that's with low back pain. There's also myofascial pain syndrome, MPS, chronic pain disorder that affects the muscles and surrounding fascia, and it leads to lots of pain. Anyways, there's information on that. Chronic pain. I've talked already about chronic pain and inflammation in general. So many people that we've seen have chronic pain that we've been able to see helped. I've already mentioned about knee pain. We've had a lot of people with different kinds of knee pain and see how to use it. Now, just as people, I mentioned shoulder pain. So if you were to use one of my Palm lights, you might spend 20 minutes to a half an hour over that whole area. And most of that time would be spent with the bright red. Most of it would be with the near infrared or the totally invisible near infrared, which is on our Super Palm light. But you'd use that for most of the time around the area on the shoulder. And then but I would start off with a little bit of time of the bright red. And the reason being is the bright red 660 nanometer has the ability to get into the blood and energize the blood, like give energy to the cells in the blood. And that goes much, much further than the area, than just the area that you're treating. So it's helpful to treat the blood, even though the 660 nanometer, the bright red, doesn't penetrate as deep. And it's kind of amazing because when you look at it, you still see it going right through my hand with the 660, but the 810 and 1050 is able to go much, much deeper than that. So there's another condition called fibromyalgia. There's been people that we've also seen help to fibromyalgia. Now, for when you're trying to treat large areas of the body, we have the mini canopy, which I'll show in a few minutes. It's the larger light. And then we have a very large device, which is 6 of the mini canopies. So if a clinic was to have that, they can treat a large area of the back and neck at one shot. Whereas to do with the palm light, it can still work. It's just going to take more time to do the treatment. So then there's, I think I mentioned neck pain, and so other types of pain. Trigeminal neuralgia, that's a very, very difficult, it has to do with one of the main nerves that are coming through the face area. Something that has to be treated very, very carefully. There's information that you can read up on it. It's so painful that they call it the suicide type pain because it just people want to commit suicide. It's so very painful. There has been some help, but that's one that one would want to work away at very, very, very slowly, not trying to do major changes in 1 or 2 treatments. You want to spread that over with very short treatments, just working your way through. But it's something that one has to take extreme caution with. Then there's neuropathy. Neuropathy can be caused by different problems that people have in their body, whether it's high blood sugar levels, injury, genetic disorders, medications, diabetes, and there's also unknown causes of neuropathy. But neuropathy can be very much helped by treating the nerves, and I'll tell you that you need to find out where the issue is. So you could, in one case that I'm aware of, the woman had a lot of like no feeling in her foot, and she was thinking, I'll treat my foot. No, in her case, the issue wasn't. It can also be from your knees. The nerves passing through your knees can be also through your hip. And in her case, it was her hip. She treated her hip, and her feeling came back in her foot. Now, she was 90 years old and had been dealing with this for quite some time. I think it was 4 or 5 years earlier, she had hip surgery for something. And ever since then, this neuropathy had gotten worse. And so I suggested to treat the hip. She did, and she was very happy to see how I was able to help neuropathy in her foot. So there's all different research articles that are on neuropathy, and you can again look that up on the web now on our website. But I do want to say as well is it's come up before many times about how much energy do you need to give the area, and somebody will quote, well, they did a study on knees and they found out that it's 4 joules per square centimeter. So that means 1 square centimeter of area, 4 joules, which in our case, with the amount of light power that we have out of our devices, that ranges from 45 seconds to a minute kind of thing in length of time to deliver 4 joules. But the problem is the study that was quoted is a rat's knee with about that diameter. Now, if you have a normal sized knee, you're talking something like that or even bigger. And if you put 4 joules on the outside of the surface, if you treat it for a minute, you're not going to have 4 joules per square centimeter in the joint area. You need to apply much, much higher levels of light. That's why I'm suggesting for knees and bigger shoulder joints or hip, with a hip, you're going to spend anywhere from 20 minutes to half an hour on that area to try and get the depth. And if you have extra weight, if you have a problem with obesity, that's going to even take a lot longer for that light to have enough energy to deliver to the joint. So you're going to have to spend a lot of time on the surface, which might mean 400 joules of energy. So I wouldn't worry about the joules. It's really about the area that you need and the depth that the wavelength to get the depth that you need. Now, our devices, the 810 or the 1050, can help with the additional depth, and that's where you want to spend the time. If you're just treating your fingers, 1 minute of red and 1 minute of near infrared, because there's not much penetration, but as soon as you have to start treating deeper, and let's say a wrist, now you're talking 5 to 10 minutes with a third of the time with the bright red and 2/3 with the dim or invisible, which penetrates much deeper. Okay. We have a really exciting news to share with you. We're going to pop up a picture here. We have been working with Shepherd's University in West Virginia, and Dr. Jennifer Flora, we've had her on one of our webinars, and she started a study on using our helmet on the brain. Okay, so just yesterday was a big meeting that took place in West Virginia at the University of Shepherd's University, and they've been using my helmet, as you can see in the picture here. They did a trial with opiate addiction and addiction and depression, and they were able to, we'll send you the link, but they were able to see great results with using that helmet on people with opiate addiction and depression. And they were working at first to try and aim to have 25 people in the control part of the study where they wouldn't get the light, and 25 that did get the light. Because of the situation, some people could not follow through, not because of a problem with my light or anything like that, but they couldn't follow through. And the interesting part about this is that they found that twice a week treatment, and it was, I think, over 2 months period, that the people that had the light treatment saw that they had much lower cravings, they had less depression, they had just a host of different measurements all improved. And although I can't show you the study yet because it's right now going through its 3rd review, there's some fine tuning to it, but basically it shows that we had really good success on helping these people. And that's 2 treatments a week, get this, of 4 minutes under the helmet. So that's 1 minute of the red and 3 minutes of the near infrared. So really, really phenomenal work, and that was done by Jennifer Flora and her team. And what's happened is there's been the large pharmaceutical companies have been sued in the and I guess the State Department won a settlement of $1 billion. That's $1 billion for a settlement for opiate addiction that was caused by this happening. So we do have the link posted there. So really exciting on how this has been able to help people with opiate addiction and depression, which is a big problem. Also, just general wellness of the brain is something that can be helped. And I'll get into that in a bit. You can look at, there's a number of articles on how PBM can be used for treating COVID, COVID long haul symptoms. So that can include brain fog, which is something that happens because of inflammation on the brain, and a person isn't able to think clearly. Apparently, it's very closely tied in with, they call it with the chemotherapy, that people have their brains are not functioning correctly. And they found that they've been able to help with this fog that people feel. So that's really cool. Another area, so I'll just show I mean, you saw it in the picture, but here's our helmet here, and we have the one wavelength, which is the red 660 nanometer, and then the other wavelength of 810. You can see a little bit of the 810 in the background there, but there's 10 of our palm lights equally distributed over the whole brain, and that's basically what the helmet is all about. It has some interesting features as far as shape and everything. That's because we got to cool each one of these devices so that we can have the energy levels that we want to have. So that's our helmet, and that's what was used in West Virginia with the success that they've had. So we're pretty happy about that coming through. We had, so brain injury, traumatic brain injury is something that we don't have any direct candidates that I can, or people that I can share with directly that I'm aware of with TBI, but we have been able to find with concussions, which is kind of a little different angle, but have had tremendous success with concussions. There is brain injury, concussions, Alzheimer's. There's a number of links there for Alzheimer's, dementia, Parkinson's. One that more recently we had an individual on, a very good friend of mine, a mentor to me. He's more senior, and he had Lewy body dementia and having a great deal of difficulty remembering names and being able to think through things. And the neat part was he was used the helmet for like 2 months and continues to use the helmet. And he was on my webinar and he was able to say, well, this is why this light is good. This is one point. This is another point. And he did it totally off the cuff without writing anything down. And his wife had said he's regained 3 years of the effect of Lewy body. So going back 3 years is how much improvement he's been able to see. So and just generalized improving brain function, cognitive function. Another area is the whole area of wellness and aging. There's so one basic thing is this light can help with collagen production, which helps get rid of wrinkles over time. That's very beneficial if you're trying to get rid of wrinkles. Also hair growth. They've been able to, there's a number of articles on hair growth as well. Fertility support. This is an area that is kind of neat that I was able to see somebody who they were trying for 5 years to have a child, and they were taking pictures of my using pictures of my mini canopy, this device here, which is equivalent of 15 of these palm lights. And with 15 of these palm lights, that's quite a bit of area, but it's the same power density. So the power is equal this way to here, the same area, but you got 15 times more coverage. So it can do a large area. That's very, very helpful to doing neat things that way. But they were taking, they had been taking some pictures of the light, and there was some issues on her, as far as fertility on her side. And she did the light and decided to do it on her own. I didn't know anything about it, but she thought she would give it a try. And 3 weeks, she was pregnant, and they gave birth to their 9 months later to a healthy, healthy girl. So that's pretty exciting. So fertility support, and there's information on that, how it can help. Another area is decreasing insomnia. People have reported that they've had much better sleep after using the light with the mini canopy, the mini canopy with the helmet. A number of people have said how much better they were able to sleep and more solid. So that's kind of neat. There's the area of sports and strength training. Before actually going to do the training, and after post exercise, pre-exercise and post exercise. Also the area of wound healing. We've been able to help people with their bed sores, and help heal them closed. Bone fractures. That's been to have bones that heal properly and quickly, and you can save a lot of time. One individual, he ended up hitting another person that was, well, he was a police officer, and he had hit somebody to stop them. They were on some kind of drugs that made them pretty much Superman. And so when he tried to stop him, he punched them, and he broke quite a number of bones in his hand here with the force. They said that they couldn't do anything. His hand was heavily swollen, and they said the bones were in all directions. And they used the light therapy, or he used the light therapy immediately. I knew him through church, and he immediately got my light from me, one of my earlier prototypes. And he said, the surgeon had said within 2 weeks they were going to look at what surgeries, how they were going to do things to try and correct all the bones in his hand. And when they looked at his hand 2 weeks later, all his bones had properly lined up, and they were healing well. And matter of fact, he was able to get back. This was his right hand for the gun, and he was able to get back on the practice range and fire without any problems. So he was able to quickly heal. So fractures, burns, I shared on some of the earlier webinars about how you can look at burns and ulcers, burn wounds, like with the boiling water. I showed about my granddaughter, how she had accidentally poured boiling water down her leg. The bowl flipped and the water went down her leg, and she used the mini canopy that I just showed you, and within a week the leg was totally, the top layer of skin was all totally healed. Top layer, there was still other healing still going on, but it had totally covered the whole area. And within a month, you could barely see that there was kind of like the outline of some change of coloration on the skin. But after 2 years, it's almost impossible to see where she had burned herself so bad. So that's burns, ulcers, pressure ulcers. We've had diabetic foot ulcers that weren't healing, that we saw. We've been able to see people save their legs from from amputation by using the light on their area. We had one of the individuals actually, the surgery was scheduled 1 week later. I showed it in a couple of my webinars where 1 week later they canceled the surgery. And within 2 months, it was down to just a smaller hole in her leg and in her foot. And then that was able to fully heal as well. And so she was able to save her foot. And that's with a tough case of having diabetes. Dental, people with TMJ, or TMD in the joint, and using the light has been able to help that area, reduce the pain, and help the muscles to release. Facial muscles. People with abscess ulcers have been able to see the infection go down in there and get rid of the pain in their mouth. So that's been quite interesting. So here's a lot of different areas I covered here, and also ringing in the ears. We've had now quite a number of people that have used the light, 1 minute of the red, 3 minutes of the near infrared, and they've been able to see the reduction of the tinnitus or tinnitus, different pronunciations. And that's been great as well. One individual, he said for 30 years he heard Niagara Falls in his ear, really loud noise. And he put the helmet on and he did a 4-minute treatment. And immediately at the end of the treatment, he took the helmet off and that noise was gone. Now, it was gone for a period of about 24 hours, and then it started coming back again. But that's something where a person would probably need to treat for the next month, or maybe it's something he'd have to treat for the rest of his life. But hey, if you don't have that noise in your ear, how beautiful could that be? So it's been able to help in those situations. Now, I am not a medical doctor. I cannot diagnose your situation. All I know is that PBM, there's a number of research studies that show how PBM can be helpful in treating some of these areas and helping to alleviate pain and inflammation. And that's one of the key things that we're trying to do here. So I'll take some questions here. If you want to send us questions, I'll check back here. Thank you from Yuli. Yuli, you mentioned about congratulations on having your product being used in that opiate study. Yes, thank you. Thank you very much. It's pretty neat. And I'm hopeful that, as I said, that we can see the oral mucositis trial take place. One interesting thing that through the one study that we're working on, and this is not a device that's available yet, otherwise I'd mention it, but we have this device that goes inside the mouth to do light treatment inside the mouth, and she did the light treatment there's inside her mouth on a regular basis, and she just was concerned about the light she was seeing in her eyes. And because it was pretty bright when she had that inside her mouth, it was actually the light was going up through the palate of the mouth into her eye socket, so she could see this bright red light. Anyways, what happened was she said she was concerned about that, and I says, well, with the amount of light that's coming through, it's a lower amount of light, and red light is quite safe. If you are on a beach in Florida, you can have that light coming at your face from laying on the beach for treating for an hour, 2 hours, sunbathing, and you won't go blind if you close your eyelids. Your eyelids do a great job of diffusing the light, so it ends up being very even illumination of light, and also reducing it a bit as well, that which is approaching your eyes. So it's very safe that way if you have your eyelids closed. Well, she was concerned about the light coming up through the palate, because it doesn't matter whether your eyes are open or closed, you see red light. And I said, I don't believe so, that you should see anything, because there's FDA has reported as far as something like 100 million treatments, and they do not have any concerns about light therapy being used. Now, when you're talking about especially with LEDs, we're talking about LEDs here, which are very, very safe. A laser is something that you have to wear special glasses. It's a point of light that if you shone it across the room, with the culmination of the beam, you could actually damage somebody's eyes on the other side of the room. In this case, it doesn't happen that way, because the light coming from an LED is very diffused. So it's very, very safe as far as treating around the eyes. But this woman, she treated in her mouth, and I said, so do you have any concerns, anything that came up because of using the light therapy? And she says, oh my gosh, I didn't even think of that. She says, I've had dry eyes for years now since the chemotherapy. And when she did the light therapy inside her mouth, she said her dry eyes have finally restored to normal. So it actually helped the glands to start healing and producing the proper fluids for the eyes. And she was super happy about that. But she hadn't thought or put the picture together until that moment when I asked her if she had any negative side effects that she knew of in her eyes. And that was a beautiful thing to see. Let's see here, just 1 second. Jodine is asking, my brother suffers from tinnitus flare-ups. He lives so far away, otherwise we'd lend him our light. He went to a local wellness clinic that offered PBM, but they only had a bed and only with red light. Would he get relief from tinnitus or tinnitus in a red light bed rather than a handheld device? The levels are very low when we're talking of coming from a bed, when you're laying in a bed, even a Nova Thor bed or some of these other beds. It's quite considerably lower than what we're talking about here. So we have optical power that's 3 to 4 times more greater in this area. So when you're putting it on your ear, that's the red. And then when it comes to the 810 or the 1050, that's going to go much, much deeper. And because of the power coming off of this, that's why we can get penetration into the ear canal, into the area of the brain that's dealing with that. Yeah, so it's really, really key that you have off of a light device, not just a little tiny light, like one that's covering an area like that, because that is not going to give you the penetration as a light that has this larger area. Plus you need that power density, enough lights, enough LEDs to create the optical power to come from this device that you need to go deeper into the area. So the area, the wavelength, and the area, the wavelength, and the power are extremely important to get extra depth. And Yeah. So with another question that had come through is about with the light being used on the brain. Yes, the helmet can do it in 4 minutes, 1 minute of red, 3 minutes of the near infrared, but that's covering a very large area. The helmet all at the same time. So 10 of these are all the way around. Whereas if you tried to do it yourself, you'd have 10 times 4 minutes is 40 minutes. So yeah, can the Palm Professional work for treating the brain? Yes. As a matter of fact, recently we had somebody who had a stroke for 20 years, having difficulty speaking, slurring, and his friend used his own light on him and treated him for like a half an hour, 45 minutes. And the next day he was able to speak clearly. Now, all they expected was a small change maybe, but in this case, it was a big change. Okay, so I hope, Maria, I've answered a little bit of the questions, but people have actually used this with their eyelids closed, treating their sinus areas, and that's okay. We've had some people that have actually closed their eyes and done 1 minute of the red, 1 minute of the near infrared, like this, and actually have seen some help to their eye condition. So it's something that I can't talk much about, but you want to check it up. Does it help lockjaw? Yeah, people have been able to open their mouth more with when it comes to lockjaw. I'm not sure about different heart issues. Okay. Another question here is, do the devices come with treatment protocols? We give generalities. If we did a trial, probably costing us $500,000, we could say that you treat an elbow with this exact amount of light, and we put it in writing that this is how you treat elbows. Now, if we wanted to say now we want to treat jaw pain, we'd have to have another $500,000 for a study to do that. We're in no position to do that, so all we can do is suggest that this can help light therapy, and it's your responsibility to do the research to check it out. What about food addictive and binge eating? Not sure, but there is some research out there about how it helps with the gut flora, and very, very important on addictive behaviors, that some of them can be triggered by the foods themselves. And that's a case of getting a handle on not only what you're eating, but you can also have problems that are ongoing because of digestive issues. And it's a case then of trying to heal the gut, and the light can help on that. Okay. Another question is, would the Palm products work on long COVID or just the helmet? No, actually, it just would be if you're trying to treat the head, it just takes longer to treat areas, but it is something that can be done with just the Palm and not have to go to the mini canopy or the Palm, the helmet. Okay. Is there a maintenance protocol, or does the device doesn't get used once the problem goes away? That's a good question. And as far as everybody is so different, that would have to see if it's something that can go away. And then you don't need to do treatment for that. Especially when coming to pain, a generalized pain is a person may treat their elbow and the pain is finally gone, the inflammation's gone, it's healed. Now you can treat another. The brain will layer the pain. So sometimes what will happen is one area of pain will shut down because it's healed. a new area will flare up that's been, or at least the brain is now making you aware that your older injury needs to be treated. So you treat that, clean that up, and then there's an even older injury. So you may end up going through that. I see I've got quite a few questions, and we're getting along in time. I think we'll go for about another 5 more minutes and we will call it quits. But okay, here's Geraldine. The question: I understand the SunPowerLED units are safe. What is your recommendation during pregnancy? I was trying to help a sick pregnant woman avoid pneumonia. I gave some home treatments, and okay, so I would say that generally to treat the area where the fetus is, the baby is, that probably I wouldn't recommend that, but other areas of the body is certainly something that a person could look at doing, and especially when it comes to pneumonia on the lungs and trying to help. Yeah, Beth is asking, have you heard anyone getting relief from Raynaud's? Yes, there's research that shows that it can help with Raynaud's. So one of the problems is that you start losing your blood flow to your fingers and it's it can actually help regain and improve so their cold is, they can't go out in cold for a few minutes, and their fingers will be, it'll cause great problems, so they have to really bundle themselves up warm and that. So Deanna is asking, how long do we hold the hand over the eye or the cheek? First the bright light. Okay, how long do we hold the handheld over the eye or the cheek? Well, the handheld, if you were using it for eye, it doesn't take a lot to go through the eyelid, so it'd be like 1 minute of each. That's all. And if you're trying to go through your cheek, it's going to be something like 5 minutes to get into the sinuses. That gives you some idea. I can't, I'm not a gut biome expert, but I can't help you there. Sorry. I don't know more. I just know that it's been, that the PBM has been able to show some help in that area. Okay. There's a question about what do practitioners generally charge for PBM session. I've heard a range of anywhere from short sessions of $40 all the way up to over 100. So I think it depends on the area that you're in. It depends on clientele that you have. I think there's a lot of variation there, and the equipment that you have to do the job. Obviously, something that the bigger devices cost a lot more, so there may be higher charges. I'm not sure about treating heart issues, but I can tell you that it's been very helpful for working with increasing blood flow, and that's really at the very smallest. The capillaries, very, very small blood vessels that one can see the PBM help get the blood flow. As a matter of fact, if a person treats themselves, they'll notice that their hands or whatever is warm for a very long time, as opposed to sometimes just using a hot water bottle, because you're improving the blood flow through the area. And again, I'll repeat, when using the light near the eyes, please close your eyelids. You can also wear protective glasses if you wish. They're available from Amazon. We can give you a link to that. And the red is something that definitely is very, very beneficial for the blood flow. So I want to thank everybody for joining us tonight. This has been a great crew that's been here. I know we've had visitors from all the way from England to Colombia to Australia, and even over into Africa and Alaska and Hawaii. So thank you everyone for joining us. I do want to ask you if you can mention where if you can text us where you joined in from, and also if you can tell us, so our next webinar is next Tuesday, again at the same time, same website. Come to SunPowerLED. Tell us if you have some kind of interesting topic that you've explored with PBM that you want addressed. We would love to try and help you on that. I'd like address it if we can. Also, we'd love to hear your testimonies of how you've used the light and how it's helped you. So please, please tell us where you're tuning in from, because it's always fun to see. I do see from Tampa, Florida, from Cambridge, Ontario. I'll just tell you a few of them here. Maria from Colombia, another person from Toronto. Hey, let's see, who else is coming in from where here? Virginia, Cornwall, Alaska. There you go, all over. So thank you for joining us tonight. I wish you all of God's richest blessings, and may we be able to see each other next week, Tuesday. Thank you for joining us. All the best, and bye for now. We're going to leave this go for a minute for those that want to still write something up in the chat. But I'm going to sign off for now. Thank you again.